So when a person has a subluxation, when they come see the chiropractor for that, what our treatment for that is the adjustment. We call it the chiropractic adjustment. Now, a chiropractic adjustment is very specific, okay? It's very specific in where it's at, okay? Because there are many vertebrae and you don't want to be on the wrong one. You want to be on the one that actually needs the adjustment, that's actually subluxated. So it's specific when we pick the one that we're going to, but it's also specific in the direction of the correction, okay? Now, obviously, like we said before, when you have a subluxation, it's not moving like it's supposed to, and it's out of position, just not so far as to be a dislocation. So we will very carefully go in and through many different procedures, including x-ray analysis. We have different kind of instrumentation that we use to also find some of the areas that have problems, and including, and very importantly, feeling how it moves, okay? And we can feel for the muscle spasms like we talked about. We can feel for the heat, okay, from the inflammation. We can feel for all of these things as well as the movement of the bones themselves. When we find the one that actually needs to be adjusted, then the chiropractor will analyze it and determine what direction it needs to move better, okay, and make the correction in order to do that, okay. Now, like I said, very specific about the adjustment is, it's very specific and detailed in the direction that we need to go. Now, because of that, chiropractors are the only ones in the world, and especially in our country with the laws and stuff that pertain to that, they're the only ones trained to do this, okay? And we go through years and years and years to learn how to make that specific correction. Now, the adjustment can be to the spine, which most people associate it with. However, any joint in the body can be subluxated. Any joint in the body can be out of position but not far enough to be a dislocation, and it causes inflammation, it causes muscle spasms, it causes all these problems. So an adjustment can also be to the wrist, okay, or the elbow or the shoulder, or like I said, in the spine, which is the most common that people think about with chiropractic. The adjustment, when it's done properly, creates a positive change in the joint. Okay, and it restores normal motion, allows the nerves to flow like they're supposed to, so we can get the right message back and forth between the brain and the body. And generally the whole health of the person increases when you get a good adjustment.